Bismillahirrahmanirrahim. Today I am going to discuss types of neuron fiber and its diseases. Learning objective of the lecture are type of neurons fiber, classification of neuron fibers, degeneration of neuron fibers, and regeneration of neuron fiber. What is neuron fiber? A neuron fiber is a thread-like extension of a nerve cell and consists of an axon and myelin sheath in the nervous system. This is a thread-like structure which is walled by the myelin sheath. Nerve fiber classification. Nerve fiber are classified according to the diameter, degree of myelination, and speed of conduction. Speed of conduction means degree of propagation of action potential. What are the different type of nerve fiber? Nerve fiber are classified into three types: A, B, C group. Group A nerve fiber composed of large fibers. The fiber of this group are myelinated, both sensory and motor in function, found in somatic nervous system. It is further classified into four subgroups: alpha, beta, gamma, and zeta. A alpha are afferent and efferent fibers. A beta are afferent and efferent fibers. A gamma efferent fibers and A zeta efferent fibers. Group B and C nerve fibers. Group B nerve fiber. The fiber of this group are myelinated. The fiber are found solely in preganglionic autonomic nerve. Group C nerve fiber composed of smallest fiber. All the fiber of this group are unmyelinated. These are unmyelinated nerve fiber. Mostly found in visceral and cutaneous nerve. They have high threshold, that is 30-fold that of a group. Generally, they are found in postganglionic sympathetic nervous system. This is the preganglionic nerve and this is the postganglionic, so they are found in sympathetic nervous system. Schwann cell are oligodendroglial cells. In the peripheral nervous system, the Schwann cells are responsible for the formation of the myelin sheath. In the central nervous system, the oligodendroglial cells are responsible for the formation of the myelin sheath. This sheath is broken at regular interval known as node of Ranvier. These are three types of the nerve fiber. The first one is unmyelinated. It has no myelin sheath. The second one is partially myelinated fiber. In some area they are unmyelinated and in some area they are myelinated. And classification 2. Nerve fiber can be classified based on different criteria: myelinated or non-myelinated. Type 1. Functional classification is afferent sensory or efferent motor, based on diameter and conduction velocity, which is known as Gasser and Erlanger classification. Larger diameter axon and more myelin in solution lead to faster signal propagation. Based on the type of neurotransmitter released from their terminal as adrenergic or cholinergic or dopaminergic, they are classified on the basis of neurotransmitter as adrenergic, cholinergic, or nerve fiber. Group A nerve fiber. Group A nerve fiber are one of the three classes of nerve fiber as generally classified by the Erlanger and Gasser. Group A are heavily myelinated. These are Erlanger and Gasser, two scientists, physiologists, who classify nerve fiber in these groups. Primary afferent axons. Here these are the nerve fibers or axons: axon type, diameter, and speed. A alpha is the thickest one and heavily myelinated. A B is the middle one, and A gamma is thin and lightly myelinated, and C fiber is unmyelinated. Diameter is 13 to 20 micrometer. AB diameter is 6 to 12 and A gamma is 1 to 15 and C is 0.2 to 1.5. Speed per millisecond is 80 to 120 meter per millisecond. Here 35 to 75 and 5 to 35.5 to 2.0. Here these are the different type of neuron: Erlanger and Gasser classification, their diameter, myelination, conduction velocity, and associated muscle fiber. You can pause the video and read them from the slide. Type A alpha fiber. Type A alpha fiber include the type IA and type IB sensory fiber of the alternative classification system and are the fiber from muscle spindle, ending, and the Golgi tendon, respectively. Myelogenesis. Myelogenesis is the process by which myelination of the nerve fiber takes place. In the peripheral nerve system, the myelogenesis is contributed by the Schwann cell, where in CNS it is being contributed by the oligodendroglial cells. The sheet of Schwann cell walk the axon by about 80 to 30 times. The cell membrane lipids form the myelin sheath. The myelin sheath is derived from the lipid of the cell membrane. Function of the myelin sheath. In myelinated nerve fiber, the velocity of impulses transmitted in faster because the process of depolarization occur only at the node of Ranvier, and therefore it appears as if the impulses are jumping from one node to the successive node. It acts as a protective sheet, minimizing injury to the nerve fiber. It acts as an insulator and prevent cross transmission of impulses from one fiber to the other in a mixed nerve. In unmyelinated fiber, the propagation is slow because the space of propagation between the depolarization and repolarization is less, and in myelinated nerve fiber, the current jump from one node of Ranvier to the other node of Ranvier or unmyelinated area which is not covered by the myelin sheath, and this large area is bypassed by the action potential. So this propagation of action potential in myelinated nerve fiber is greater than the unmyelinated nerve fiber. Linear degeneration. Linear degeneration is an active process of degeneration that results when a nerve fiber is cut or crushed and the part of the axon distal to the injury degenerate. You can see that this nerve fiber has a normal myelin sheath and there is a normal supply to the effector organ, and the organ is normal. But when the myelin sheath is damaged or when it is transected, the impulses to the effector organ are lost, and due to a mobility of that organ, it is degenerated, and this degeneration is called linear degeneration. Schwann cell and endoneural fibroblast in peripheral nervous system. Nerve growth factor NGF is produced in very small amount. However, upon injury, nerve growth factor messenger RNA expression increased by 5 to 7 fold within a period of 14 days. Nerve fiber and Schwann cell play an important role in increasing expression of nerve growth factor messenger RNA. Macrophages also stimulate Schwann cells and fibroblasts to produce nerve growth factor, while macrophages drive interleukin. Regeneration. Regeneration follows degeneration. Regeneration is rapid in peripheral nervous system, allowing for rate of up to 1 millimeter a day or of regrowth. 1 millimeter a day a growth. It is supported by Schwann cell through growth factor release. CNS regeneration is much slower and is almost absent in most vertebrate species. The primary cause of this could be the delay in clearing of myelin debris. Myelin debris present in CNS or PNS contains several inhibitory factors. The prolonged presence of myelin debris in CNS could possibly hinder the regeneration. Multiple sclerosis. It is autoimmune disease causes may be genetic or environmental. Antibody and white blood cell in the immune system attack myelin, causing inflammation and injury to the sheath. Loss of myelin lead to leakage of potassium through voltage gate channel, hyperpolarization, and failure to conduct action potential. This is is a normal myelin sheet, and here the myelin sheet is damaged. When damage to the myelin sheet occur, leakage of potassium occur from the nerve fiber, and there is slow conduction or no conduction to the affected organ, and there is no contraction in the organ, and when it remains immobile, ultimately leads to atrophy with passage of time. Peripheral neuropathy, autonomic neuropathy. Most commonly it is seen in person with long-standing diabetes mellitus type 1 and type 2. Neuritis, it is a general term of inflammation of a nerve or the general inflammation of peripheral nerve system. In prolonged diabetes or chronic diabetes, peripheral neuropathy occur in the organ, especially the pits are insensitive to pain, and when damage occur, foot damage or damage in any organ occur, the healing of that organ become delayed because due to improper supply of the nerve fiber and high glucose level, which is a favorable condition for growth of bacteria. So diabetic foot is a medical emergency and it needs proper attention and emergency treatment. As a rule, I have added again questions. Question 1, please pause the video and select the correct option. If your option is C, this is the correct answer, and in question 2, if your choice is C, again it is the correct answer. So thank you. Please subscribe the channel and write down your valuable comment in the comment box for the improvement of the channel.